Good morning, everyone. Today is Thursday, May 8th, 2025. I've got to remind us all what day it is. The council is meeting today to continue its review of the FY26 operating budget and amendments to the capital improvement programs. Item 1 today is the budget consent calendar for the operating budget and capital improvement programs. These are budgets that committees went through and either had no change or minor changes to them this year, so they're on consent. I will entertain a motion to approve the consent calendar.
So moved.
Councilmember Lukey moved. Councilmember Balcom second. All those in favor, please raise your hand. And that is unanimous of those present. All right. Next, we're moving on to our work sessions, and the first item is the inflationary increase for all nonprofit providers. Take your time. And this is an item that does show up in different department budgets, but because it's across the board, we wanted to take this up as the full council. So I'll turn it over to our council staff to walk us through the package.
No problem. So for the FY26 operating budget, this is a 3% inflationary adjustment to nonprofit contracts. The main information here is that the county executive is recommending this 3% inflationary adjustment, and it's totaling about $5.2 million across multiple departments, the specific number being $5,252,556. The executive's recommended 3% adjustment is resulting in an increase of $5,137,901 in tax-supported funding and $144,655,000 in non-tax supported funding. You'll see a table on the next page of your packet which shows how the proposed 3% adjustment is distributed across all of the departments and NDAs. Of note is that about $3.5 million of that, or 68% of this total amount, is within the Department of Health and Human Services. The executive's recommendation for the 3% increase is also consistent with the increases the executive has proposed for organizations providing services to persons with developmental disabilities and the supplement to the adult medical daycare providers as written in the original budget that was transmitted back in March. Council staff also notes that each 1% increase or decrease in the inflationary adjustment is equivalent to $1,750,852. With that broken down, $1.7 million of that is tax supported and $38,218 of that is non-tax supported. Thank you.
Thank you. And I just want to say thank you to members of our nonprofit community who are with us bright and early this morning. And I will turn it over to colleagues. First, Councilmember Albanaz.
Thank you so much, Madam President. I know all of us support this because of the reasons we know are very real and raw right now. Need is increasing across the board. It has not subsided since COVID, and obviously the actions of this presidential administration just in the last 100+ days, which feel like 100+ years, has really exacerbated and impacted our community, especially those most vulnerable. So, and this council has been very supportive of our staff and of our county employees. And nonprofit organizations, just like county government, the vast majority of their budget and operating budget is made up in people. And we know of the inflationary challenges and increases that are impacting these organizations, but really it's the personnel that they have to recruit and retain that are critically important to be able to expand and extend the services that we provide within county government. So I wholeheartedly support this recommendation, feel strongly that it needs to stay in through the budget process because we have to put our nonprofits in the best position we can to weather what we know is a very complicated storm currently and ahead.
Thank you. Councilmember Alvarez, Councilmember Fanny Gonzalez.
Good morning, everyone. I'm going to echo the words of my colleague, Councilmember Albornoz. I had to say it, just because of the number of emails and calls and text messages throughout the whole day, even at night, that I have received from our friends. And as chair of the Economic Development Committee, I have said and the nonprofit sector is part of our workforce. You know, we don't function without a dynamic and strong nonprofit community, and that's who you are. And I don't think anybody, I know I cannot speak for my colleagues, but I have never heard a single council member say that they don't want to have this increase or don't support this increase. So I don't know where the fear came from. But I'm here to say also that I will 100% vote yes on this particular item. So thank you.
Thank you. Councilmember Balcom? Okay, 3 in a row.
So of course, we rely on our nonprofits to do so many things in our community, to do the work of the government. And this, for me, is about parity. I ran a nonprofit for a very long time, and it's so difficult to meet our just basic inflation costs, particularly in keeping our staff. And I know that when nonprofits try to stretch a dollar as far as they can, the first thing that goes is increases for their staff. And that's just, it's not fair. When the county, we unanimously passed a compensation package that is 6 to 8% increases. And so I know how desperate our nonprofits are for this money, and so I will be supporting this. Thank you.
Councilmember Friedson?
Thank you very much. I could just say ditto to Councilmember Balcom, per usual, the last couple of days, but just want to reiterate, we're asking our nonprofits to take on Health and Human Services roles to provide services to some of our most vulnerable residents, and we can't have that conversation without the broader context of all the services that we're providing, all the costs that we have. Their costs are going up for the services that we're asking them to provide as part of the broader social safety net. I don't think we can have it as a separate conversation, which too often it is, where we talk about the Health and Human Services and the county government, and then we talk about our nonprofit providers. And the reality is there is really a social safety net of which our nonprofit providers are a core part of, and we have to have the conversation together. And so I'm very much, as I have previously been, strongly in support of providing our nonprofit providers with this support. It is less than the additional support that we're providing for those who are serving in county government, but it is the minimum of what is required to be able to maintain the services that they're providing on our behalf to serve our community. So I just want to express my appreciation to them. Some are in the room, others are not, because they're doing the work right now, and just want you to know how much we appreciate you. Thanks.
Councilmember Lukey?
Thank you, Madam President. You know, as a member of the HHS committee, of course, a lot of our nonprofit providers are working in that space and delivering the work that we as county government can't do directly. We need to have these partnerships and certainly value everything you do tremendously. And of course, I support the 3% inflationary adjustment. I think I was really caught off guard or really surprised that anybody was made to feel anxious about that. And for that, I am sorry, because that should have never happened. And I don't know where that came from. But I know that I personally, as I, spoke to many of you over the last week or so, was very forthright in saying I had not heard a word that this was ever in question, or that anyone had concerns about it. And I just want to say, particularly at this time when there is heightened anxiety around a great many things, that I'm sorry that you had that extra thing placed on your plate, because you shouldn't have had to. And I'm happy to bless this today.
Councilmember Glass?
Thank you very much. Clearly, there's a theme that you're hearing from the body, and that we need our nonprofit partners right now more than ever. We need to make sure that our social safety net is as strong as possible, and it is our nonprofit partners who do that work. And over the last few days, those of you who called and emailed and texted us, I would have preferred that you'd be helping our residents. It was effort that was misplaced, and I'm sorry that a directive was shared. We value you. We're here with you. We are going to provide this support and keep doing the good work that you do.
Councilmember Mink?
I mean, I'm loving this. This is definitely something that we all stand together united on, that we know that our nonprofits are an essential core part of our county infrastructure. Needs are increasing, not decreasing, and we need to make sure that all of our nonprofits who are our partners in this work have what they need to continue moving forward and to address, again, what is an increasing need. I know that you all are seeing those increases already. It's already a struggle to serve everyone who's now coming to your doors, and we know because we send many of our constituents, we rely on you. We send our constituents to receive services from you all the time. So we do absolutely need to make sure that you have what you need. And this is, as has been said, this is really the bare bones. This is the minimum to continue moving forward. Certainly, as we all know, we don't know where we're going to land with revenue. And most of the options before us do have us going into, looking at items and having to trim from things that were approved by committees already, that were sent over by the county executive and approved by committees. But that said, what you are hearing from us today is that we have a commitment to ensure that our nonprofits have this increase, have what they need to keep moving forward, and we thank you so much for your service.
Councilmember Katz?
Thank you very much, Madam President. I really wasn't going to speak on this. I felt this was a non-brainer. This one made no sense that we were going to do anything any different. And then I started hearing about the misinformation that was being discussed in the communities. And it concerned me, but I certainly know that we're going to do the right thing right now. The work that the nonprofits do are separate from government. Everybody's talking the same thing, but you're an extension of government. We government, could not do what you do as efficiently and knowing the communities you work with. We need to make certain that you're funded. And it also is interesting to me that nonprofits are organizations. They're organizations, but they're made up. The reality is they're made up of the people who do the work. And we have to pay to make certain that the people who do the work you're never going to be paid to the degree you should be by government, but you need to be paid to as much as we can pay you. So with that, I certainly support it. Thank you, Madam.
Thank you. Councilmember Sales?
Thank you, Madam President, and I echo the sentiments of my colleagues serving on the Health and Human Services Committee. I hear all throughout the year what these resources mean to our residents and the nonprofit organizations, the leaders that provide these services, who reach the communities that we aren't always able to reach, and who see the people in our communities that we may not necessarily see here in our chambers. And so I am overjoyed and grateful that in such a difficult budget season that we all share the sentiments that we wish we could do more, but this 3% adjustment is just the start to show our appreciation for the work that you all do all throughout the year. And so we will be calling on you more in the coming months because of the decrease in resources from the federal government and almost feeling like an island. Our resources are now comprising over 50% of the state's budget, where we are providing a lot of resources to the state, and we are getting less and less support from the federal government. And we're going to have to do more and more for our residents, where a large majority of our residents were impacted by the federal cuts, live here in Montgomery County. So thank you so much for your patience and your resilience.
Council Vice President Joanda?
Ditto, thank you. Can't wait to support it. Councilmember Alvarez, Chair of HHS, where almost 70% of this will go. We talk about this a lot. He's on the Education and Culture Committee as well, and all of us care about the work you do. And I know this is not going to do everything, but it's something that we can do to show that support. And I'll continue to volunteer like many of us do, so you'll get some free labor out of us, I think, continued. Thank you for everything that you all do.
Thank you, and I'll just round it off by saying I'm glad you all are here, and we know all that you do in our community, and we know, as I think a number of folks said this morning, the 3% is kind of a floor of what you need, and we are here with you to work in partnership as we weather the storms that are facing us right now. And we know it's a very anxious time, and I just really appreciate the partnership we do have now in looking at ways at how we're going to continue together to serve our community. Like my colleague, Councilmember Balcom, I worked for and helped run a nonprofit. Knowing those ins and outs of the daily pulls and takes of what a nonprofit has to do to survive, particularly in these storms, is really hard. And I just want to thank you all. And I'm going to call the hand vote on this so you all can get out of here and don't need to listen to more of us today. But again, just appreciate the collaboration and work you're doing, very much so. So with that, we have the 3% increase for our nonprofit providers that was in the county executive budget. All those who are in favor, please raise your hand. And that is unanimous. Thank you all again for joining us, and we look forward to continuing the work together. All right, thank you. We will now move on to our Office of Food Safety Resilience, and I'm going to turn it over for what is going to be a long day for Councilmember Albanaz as he reports out on the great work of the HHS committee. Chair Albanaz, it's all yours.
Thank you. Apologies in advance. You guys are, I'm sure, going to get tired of hearing my voice, but you'll be in good company because my kids often feel the same way. Thank you all so much this morning. I'll just make some brief opening comments and then obviously turn it over to our extraordinary team. I want to thank Councilmember Sales and Lutke for their outstanding partnership and leadership. And I'm going to state the obvious here. We all know that the need is growing in too many categories to count. And we know that the disorienting policies being set forth by this administration are disproportionately impacting our vulnerable community. We also know that we have a remarkable social safety net infrastructure here in Montgomery County that we have been investing in for generations. And you will see as we go through this operating budget for more of those investments. And we've also seen real strategy and vision. And there's no better example of that than our Office of Food System Resilience. The Office of Food System Resilience, of course, was established in the midst of COVID when we saw that we had a great tapestry of nonprofit organizations doing wonderful work in partnership with the county, but that too often those organizations were flying blind, the work was not coordinated, and we needed to have a home base in order for us to be more appropriately and strategically dispatching something as basic and important as food and nutrition to our community. And so I want to thank Director Bruskin and her team who continue to do outstanding work. And I really honestly do. I sleep a little better at night knowing that the Office of Food System Resilience and systems like it exist in our community because it is going to help us moving forward. Ms. Bruskin, I'll turn it over to you to make some brief opening comments, and then I will turn it over to Ms. Clemens Johnson to walk us through the packet. Oh, I apologize. With your indulgence, Council President. Okay.
All right, absolutely. Go ahead.
Good morning. Thank you so much for the opportunity to come before the council this morning and discuss our community's food security needs and food systems challenges and opportunities. And so much appreciation both for your partnership and consideration of our proposed budget requests. As we've shared with the HHS committee in our earlier session, we're both following what is happening and what is possible, and we remain steadfastly committed to to closely following developments at both the state and the federal level and keeping our leadership informed as to how that is directly impacting our communities. So while we've certainly talked about what is possible, I think it's also important just to center updates that have happened, even since our HHS committee session, of what we know is actively happening. We know that the Meals on Wheels federal agency that oversees those funds has been dismantled. And so though the budget funds may exist, the administration that keeps those services going is not staffed. We've heard from the Capital Area Food Bank that 28 tractor trailers of commodity foods that were coming to them for distribution in our community have been canceled. And those were high value items like proteins and other resources that are supporting food distributions of over 50 of our own county providers. Our Maryland Market Money program, which provides matching dollars at farmers markets. I heard from a farmer just yesterday of how the previously $30 cap on purchases has now been scaled back to $10 per purchase, which doesn't get you very far when you're buying produce and other food products for your family. There's been a directive to share client data related to nutrition assistance programs. And so we're looking at what that means for our SNAP outreach providers. And finally, that there's been 40% increase reported by our food assistance providers in their costs of sourcing food. And 85% of our budget is really, of our program budget is dedicated towards buying food. And so even though there may be flat funding, the way that looks on the ground for the resources that are available is severely diminished. And so really appreciate the opportunity and the leadership here to connect what we can do here as a community and leveraging that expertise of the nonprofit community that was just celebrated to support our residents however we can. So thank you.
Thank you. And just even the tracking of that information and having it being coordinated is a giant step forward from where we were just a few years ago. So we look forward to moving forward. I'll just give a quick overview. The county executive's budget recommends a slight decrease of 1.79% from the FY25 operating budget, and that is largely because of two one-time grants that were eliminated, one in the amount of $1.1 million from the Capital Area Food Bank and Manna Food Center supporting food staples, and then the other was $1.75 million food staples program transition through pandemic providers. We remain nimble so that and a partner, and so as information adjusts on the ground, this body stands ready to support yours and our community's work. Ms. Clemens Johnson, if it's okay, I'll turn it over to you.
Good morning, and thank you, Councilmember Albornoz and council members. Just highlight a few items. Councilmember Albornoz mentioned the FY26 recommended budget item. On page 1 of your packet, the committee recommended a reduction of $100,000 to the Community Gardening Grant Program. I just want to state that the Community Garden Grant Program was originally funded in FY24 as part of the strategy to end childhood hunger. So this is the grants went off cycle and paused in FY25 to better shift the timeline of the grant to better align with the growing seasons. So the budget of $200,000 is anticipated to assist 5 to 10 organizations. I believe the committee went with a reduction based on affordability guidance, and that this was starting a new cycle, so it wasn't affecting any grantees as of right now. I will also highlight that your packet also mentions 2 positions that are listed in the packet but as budget neutral, but of course they still have budget impacts. There is an admin specialist 2 position being added and a program manager 1 position being added. Those are currently supported through broker contracts, and so the recommendation is to shift those, but they will be fully offset by the reduction in contractual expenses. But the budget for those items are listed in your packet. So for FY26, one of the positions will be $83,779. And for the program manager position, FY26 recommended expenditures will be $90,065. And I'm available to answer any questions.
Sorry. All right. Well, I'll just kick us off and say thank you. As I think, as the chair said, as Councilmember Albornoz said, having you all in place to help coordinate these services, collect the data, report back to us and trends has been hugely helpful. And so just wanted to say that and thank you for all your work. And just to let my colleagues know, we do have a committee recommendation of a reduction of $100,000 that we will take a hand vote on today. But first, I'll turn it over to Council Vice President Jawando.
Thank you very much. Also, just very appreciative of your work. We've been on a long food journey together, and you all are a huge part of it. And it makes me very happy and relieved. I know it's going to be difficult, but the fact that we have you in place with what's going on, as Councilman Albornoz mentioned, the fact that we can even track these things, try to redirect resources, know it's going to be difficult, but we're in a lot better positions than many. And I thank you for that. Of course, we'll support. Just wanted to point out, obviously, in my role as Chair of Education and Culture, this is the food and work is really connected to our students. Several of the budget changes before us are related to students, like the school-based food assistance program, which we're proposing to expand to 20 schools, more than the 60 that already have projects in place. And then for the pop-up pantry services, which our students and families use. So these are going to be even more important. Appreciate the executive for including them, and thank you for being here. I'm looking forward to supporting them. Thank you, Madam President.
Councilmember Fanny Gonzalez.
Thank you. I understand. You know exactly probably what I'm about to say. The community garden program it's so important. I understand the reduction. I get it, but I'm wondering if you can please speak about how, knowing all the cuts that we're going to be having at the federal level, right? This garden, so people understand, this is where community members, it's not just to socialize. We're actually growing food for people in need in their own neighborhoods. That's how important this is. What are the actions or strategies that you're going to have in terms of helping identify other sources of grants that can perhaps supplement any cuts that we're going to be having in this area?
Thank you very much. I completely agree that this is a perfect example of a program that helps people in the moment, but also really builds our resilience and strength as a community for the future. And that is something that we always need to hold in balance as we make budget decisions. And I know there are difficult decisions to be made, but through our FY24 gardening grant programs, there were 1,800 residents that were directly receiving food through this program. In addition to getting those nutritious benefits, they're also getting the educational and the emotional wellness benefits of having access to land and to space and to soil, as well as the community. And I think these programs are a great example of a relatively modest investment that's made in the expertise of our community-based organizations and our residents themselves. And we saw a 50% increase in the amount of land that the organizations, the 7 organizations that were funded, having in food production because of those grants. And so I think as we move forward, our goal is always to support our organizational partners, and there are 70 nonprofits that are funded one way or another through our office. Work with Nonprofit Montgomery, work with the Food Council to build their capacity for seeking additional outside resources, and that is something that we have always strived to do and will continue to do. And we hope through the strategies that we've been putting in place through our own grant programs are building their capacity through experience to have the data and the expertise needed to communicate about their program to seek other sources of funding. And so, we have Juan's incredible talents on our team working with them specifically around data collection, and that can hopefully lead into other sources of funding. But the reality is a cut will mean that we'll have as much money to steward. These organizations are currently operating. And so I think we'll have to make some difficult decisions about what we choose to continue supporting, as well as what we, if we'll have the ability to bring on any new opportunities.
Sorry, Councilmember Friedson.
Thank you so much. I just want to echo my appreciation. I'm currently serving as the chair of the Food and Agriculture Policy Committee at Council on Governments, and I can just share with colleagues how much of a significant role that Heather plays in the regional food conversation and the leadership that she has provided, the partnership with me and with COG staff and with all of our regional partners. So I am very much in support of this budget, very much appreciative of everything that you have done to get the office to this point. I appreciate Ms. Nardi for your work as well, oftentimes behind the scenes, but very much a critical part of the work. It's going to be needed now more than ever before, given all of the federal impacts that we are facing, and it's an opportunity for us to show our mettle, like the birth of this office, which came out of the pandemic, and a crisis created an opportunity. And unfortunately, I think we were hoping that the next crisis wasn't going to happen so quickly, but here we are, and we have to be prepared for it and provide the basic of basic necessities. Food is the first one. Food, shelter, clothing, food is first. So thank you for your work, and just wanted to lift that up.
Thank you. Councilmember Sales.
Thank you. I cannot speak highly enough of Heather and her entire team. From before this office was created, the work that you've done to get this off, and during the pandemic, following the pandemic, I just think this work is incredible. And just thinking about the cuts to the community garden, I was thinking of the proverb, give a man a fish, you feed him for the day, but teach a man to fish and you feed him for a lifetime. And, we have provided resources to the Parks and Recs Department for a community garden. So this could be an opportunity to collaborate and spread this initiative further. And it's the farm in Up County that does the Underground Railroad. What's the name of that community farm? Button Farm, the Button Farm? Yes, the Button Farm. And so I remember we did that Mother's Day event at the mobile community home, and they provided all of those vegetables and plants for residents to start their gardens in that mobile community. So this is an opportunity to tap into the many partners that we already have. And if there's any introductions that you need to ensure that we meet the needs, because I'm sure there's going to be a wait list with the limited funds for the community gardens, don't hesitate to reach out. Thank you.
Thank you. Councilmember Albornoz.
Thank you so much. I appreciate the comments of all colleagues, and I have visited this program, and I can speak in the first person. I had the opportunity to meet with the folks that benefit from it. It is a terrific program. This is going to be a theme as we go through the HHS budget. It's sort of picking like the least worst options, and because the program's in a bit of a state of transition, it made sense to make the reduction now, even though, of course, we didn't want to make it. So, but just wanted to provide that context.
And thank you, Councilmember Albornoz. This is going to be a tough day. And I know that, and I very, very much appreciate your leadership on HHS and the entire committee. But we do have before us a reduction of $100,000 from the county executive's proposed budget to the Office of Food System Resilience. All those in favor of that reduction, please raise your hand. And that is unanimous. Thank you so much. And as we have been saying to many departments, there is a great deal we don't know about what's going to happen in the next few months ahead. And I know you are in contact very much so with the HHS committee and all of us as you do this work. So let's keep in constant contact. And thank you again for all your work. Yeah. Council Vice President Jawanda, did you want to speak to the consent calendar earlier?
I would.
Okay.
I'd like to just be recorded as voting in the affirmative for the consent calendar. Thank you, Madam President.
All right. Thank you. And Councilmember Mink?
If I could do the same.
Great.
Thank you.
Awesome. Thank you very much. We're going to have a slight change to the agenda and just, it's all HHS this morning, but we're going to first do the Public Health Department. So that's item 10 is going to go first. And I'll turn it back over to Chair Albanese.
Thank you. We'll let our colleagues get situated. But needless to say, our public health team has done extraordinary work both prior and during and post-COVID. And many of the recommendations you will see set forth before us today build off of the infrastructure that we were able to develop through COVID. I'll note, just so that colleagues are not surprised, there are going to be some slight adjustments and amendments made to some of the, I will move some committee recommendations that I don't want to do. But in the spirit of the conversation we just had, and in an effort to try, as we reconcile the budget over the next several days, put this body in as best a position as possible to make tough decisions, I will be moving some adjustments and changes to what we discussed in the committee. And as we go through the packet, Ms. Clements Johnson will be able to enumerate those and articulate them better than me. But before I get started, since this is Dr. Bridgers' first opportunity to speak before us today, I will yield to him to make some opening comments.
Good morning, Council President Stewart, Council Vice President Jawando, HHS Chair Albornoz, and the entire council sitting this morning. In the interest of time, I will definitely refrain from my usual soliloquy. Suffice it to say that the department supports the county executive's budget. I would also like to thank the executive and the county staff who continually partner with the Department of Health and Human Services to ensure that HHS's critical fiscal timeline, lifeline, all of those things are available for our most vulnerable residents, which has been a recurring theme this morning. Lastly, I would like to thank our service chiefs, who you will hear from today, and they've joined me, and I think it's paramount that you hear that granular level detail from them, because they have meticulously evaluated a budget that supports equity, fiscal responsibility, and stability. And I will end with the county's motto in my French-speaking voice, Gardez bien, keep well. Thank you, Councilmember Albornoz, Council Chair Albornoz.
Thank you, Dr. Bridgers. I appreciate that a lot. So, and thank you, Dr. Ashford. I know that you're representing the public health team this morning, an extraordinary team. Would you like to make some opening comments on behalf of the public health team?
Sure. Good morning. Thank you, HHS Chair Albornoz, President Stewart, Vice President Jawando, and the council. I have the unique honor of being able to lead the incredible public health team, which really serves as the safety net, which again, we heard the importance of through the discussions we had this morning. Many of the partners that are the hands of the work that we do, we're here in support of the inflationary adjustment. But just want to say we are the last resort for many of our residents when, for whatever reason, they can't access the system that many of us have the privilege through our private health insurance, when they can't access systems where they can receive culturally competent care or providers that speak their language. That is what we do in public health services. For managing across the lifespan, really providing those medical homes, our safety net is run by our team, and we have a dedicated group of individuals that do that work every day. I know it is a challenging budget year, and there is a lot changing at the federal level, which is, trickling down and impacting us. We're going to continue to do the best that we can with what we have, and we appreciate and thank the council for your support in these incredibly challenging times. Thank you.
Thank you. Madam President, I turn it back to you.
Great. Thank you very much. Ms. Clements Johnson, do you want to walk us through this section of the packet?
Can I request that we start off with the DHHS overview? There are two budget items that are connected to a service area. I apologize that it wasn't listed in your agenda.
No, is that okay? Yep, that's good with us. Yep.
Okay, thank you so much. So we'll start on page 2 of your packet, highlighting that for the FY26 recommended budget for the Department of Health and Human Services is an increase of $43,728,543, or 8.56% from the FY25 operating budget. There is a total increase of 65.62 FTEs. On page 4 of your packet, for HHS, we usually highlight the vacancies and lapse, as this is the third largest department within county government. As of April 1st, there was 184 vacancies. One thing that our department director highlighted was that even since April 1st, there have been some great efforts to hire, especially with the changes happening at the federal government. There was recently a job fair that DHHS participated in and recruited for around 40 positions. And I will highlight that this is this vacancy, even the 184, is significantly reduced from 3 years ago when the vacancies were more like 350. So I think it speaks to the work of OHR and DHHS to get those positions filled. I'll stop to see if there's any questions. Okay, there are 2 items that are not within a specific service area within DHHS. The first is a salary equity adjustment. This is for $994,034. This item is related to an equity adjustment originating from a memorandum of agreement with McGeo for our social workers and therapist positions within DHHS. So this is a one-time adjustment. It's more of a requirement since it is connected to our McGeo agreement, and there was approval by the committee of 3-0. And the next is the annualization of the infrastructure positions approved by supplemental 25-35. That's 1.3 million and 11 FTEs. This was approved by the council in January 2025, recognizing some of the infrastructure challenges that DHHS has shared. These positions, some of them are revenue generating, others of them are not. I think there's also 2 school health nurses included. There's a position within services to end and prevent homelessness, and some with the chief operating officer. So the committee recommended approval 3-0. Okay, so we can flip to public health services. If you're going through your packet, and as my colleagues and I go through the agenda, we'll probably be flipping back and forth because the packet isn't really organized according to the agenda. But there are a number of items within public health services that are recommended. I think this area has the most items. Councilmember Albornoz, did you want me to go through each of them?
Yes, please.
Okay, we will start. So the first is, so we're going from largest to smallest. The first is the increase to the Montgomery Cares reimbursement rate to 45% of the cost of care. So Montgomery Cares provides primary care services through around 20 plus Montgomery Cares clinics throughout the county. They see folks that are uninsured and make incomes less than 250% of the federal poverty level. This reimbursement rate is to help support the clinics who provide that care every day to our residents. And so this increase of $963,361 reflects a reimbursement increase from $102.15 to $113.36 per encounter. So the committee recommended approval 2-1. I will note that Councilmember Lukey voted not to support the executive's recommendation, and staff had recommended proposing the primary care increases in tranches. So the tranches were in schedules of 3. It was $6, $3.35, and $2. If additional information is needed, it's referenced in the general packet, and I can answer any questions.
Yeah, I'll just speak to this really quickly. First, very much appreciate Councilmember Lukey's comments, and she'll probably want to elaborate, but she was just doing her best, as we all were, as we went through the budget, to try and find savings where we could find them. But she stated very clearly, and as I'm sure she will now, she wholeheartedly supports our primary care organizations. I'll just say 3 things about this. One, this was one of the items that we did not fund in last year's operating budget that gave me the most heartburn, because we have seen the results of not fully funding the primary care's request. Several of our primary care clinics have had to let staff go, and their expenses have gone up, and that was even prior to the transition to the new administration. And so we still don't know exactly what the adjustments will be to Medicare and Medicare, but we know they won't be positive. And we also know that our particularly vulnerable residents, those that don't receive federal support for whatever reason, could be documentation issues or otherwise, rely heavily on these particular clinics. And this 3% represents, just as the 3% inflationary increase of our nonprofit organizations, the floor. And this is something we're going to have to look at moving forward because these clinics are critical, as all of my colleagues know, to our overall public health infrastructure. And many of them provide culturally appropriate services that are not provided in other such settings. So for those reasons, the committee recommended supporting this recommendation.
Thank you. I'll turn to Councilmember Lukey now.
Thank you. Yes, since the HHS budget is so large to begin with, and we were at the beginning of the budget process as we were taking up this item, and I greatly appreciated our analyst team, our staff team, trying to come up with ways to help us look at everything in fuller, more complete context. That is why I supported their method, which is not what the committee went with, but it was simply to give some flexibility in the analysis as we look at the totality of things, as we have been doing this week. But certainly I concur with everything that Chair Albornoz just stated regarding the importance of the Primary Care Coalition, the work they do, and the fact that even with the increase that we are going to be able to give, it's still not what is needed overall in order to make the appropriate adjustments. So I certainly appreciate their work and what we have to do here today. Thank you.
Thank you. Councilmember Sales?
Yes, I just want to quickly echo the sentiments of my colleague. While I did support this very small, but not insignificant increase, it is significantly below the market rate, hourly rate for our primary care providers who provide this much needed service to populations, as our panel has mentioned, don't have access to the luxury of having private health insurance. And so I hope my colleagues can support this line item. We know that most of the folks who frequent our clinics are the people who may be serving us in the community, in our restaurants, or in other places. And so we want to ensure that everyone has access to the best health care, and however we can do that to ensure we don't lose any of our primary care providers, this will help us ensure that we stay consistent to meet their needs. Thank you.
Thank you. And I just want to underline, and I asked the Chair Albornoz because I really appreciate him highlighting the fact that last year many of us have talked about, unfortunately, that we did not fund the HHS budget at what we should have. And we have acknowledged that. We have done supplementals throughout the year. And I think it's important because we are making very tough decisions in this budget to realize that some of these things that are under increase or enhancement, in my mind, truly are not increases and enhancements. Is because we did not fund you last year. And this pretty much this one falls under that category. So thank you. Ms. Clemens-Johnson, I think you can continue.
Thank you. So the next item really speaks to the same thing, is that so there was an increase in the encounter rate for number one. Number two is an increase in the budgeted amount encounters. So this is a recommendation that the budgeted number of encounters increase from 72,000 to 78,000. And it also recognizes the expansion to a new clinic called the Exomic Center of Maryland, located in Gaithersburg. So this reflects that budget item. The HHS committee did take the staff's recommendation to reduce the specialty care line of the budget. So there's the increase in the primary care encounter rates. There's an increase for specialty care overall across the network. And then there is the addition of the ICM clinic and the funds needed to support that. So the staff's recommendation was to cut the specialty care line item in half. I will note that the number in your packet is incorrect, as it did not include or reflect the reduction in indirect that would be needed also. So the corrected number is $81,827. And that will be reflected on your reconciliation sheet. So I will just note that for that item and can answer any questions.
No? Continue,
Okay,
please.
we will continue to move forward. The next item is continuing staffing for the core HIV, AIDS, hepatitis, and other STI services. despite grant reductions. So this is supporting 6.3 FTEs at $848,709. This is really replacing federal funding for our existing positions. The positions support the HIV clinic, the dental clinic, 2 SDI clinics, including our new clinic in Germantown, and community outreach activities. So this is funding current positions. If it is not funded, that will mean that the DHHS would have to try to find other funds or let those positions go. The committee recommended approval 3-0.
Yeah, I think it's worth pausing here because this is one of the things that I think is the most disturbing about what we're seeing, and this was a trend that actually had started prior to this White House, and what we're seeing in the rates of, particularly of STIs among our young people and other things in this category in our HIV rates. So, Dr. Asher, I don't know if you want to speak to this item.
Sure. And if you go through the YouTube archives, I believe our last Board of Health update, the second to last Board of Health update, we actually shared how our STI rates are increasing. We were right on the cusp of having a syphilis outbreak, which is now under control. But we are seeing rates of STIs go up, and the team has been working incredibly hard, not just through treatment, but also through outreach and education. And you can't really have one without the other. You can't provide clinical services that nobody knows about, or we're not in the community spreading the word on how to access those services, or at events bringing testing and things to the populations that we're trying to serve. The team's worked incredibly hard to make inroads and establish partnerships with Montgomery College, and we have been doing a lot of work to really expand our services to Germantown. We just started got the Germantown clinic up and running. So unfortunately, we've seen cuts from the state, and I anticipate, we don't know what's going to happen, but we don't have the funding to continue services at the current capacity. So if this is not funded, what that means is we will likely need to cease services at our Germantown clinic, and we will need to drop the number of clinic days for our HIV program, and we would need to lay off staff that are providing these services. So that is what I would add.
And Madam President, the only thing I would add to Dr. Asher's comments is I'd like to recognize and thank Dr. Davis for all of her work in this space. Montgomery County continues to lead the state of Maryland in managing communicable diseases. If you recall, 3 years ago, we had an Mpox outbreak, and everyone in the county replicated our strategies and our services. It is because of our great health team. So this is one area I like to emphasize support.
Okay, we will continue to move forward. The next item is number 4, support for the Care for Kids program. This is recognizing the supplemental that the council approved in January 2025, just that there's a growing need in the program. The number of children are increasing, therefore the number of services, wraparound services, specialty care, medications are needed. So this increase of $33,785 it replicates the supplemental to ensure that they can continue the same level of work in FY26. All right. Next item is to partner with the community dental practices serving at 300 East County residents without access to dental services. So the executive is recommending this. The executive is recommending this program to target residents in East County. The funds will use to directly reimburse dental providers for dental treatment. So treatment not provided directly by County Dental Services, but they will contract with dental providers in East County to provide expanded services for those residents living in that area.
Councilmember Mink?
Wanted to thank the committee for their support of this and thank HHS for ensuring that this made it into the budget. This is here obviously because we know that it is a critical need. There are places where we have residents who don't have access because of the geography of where they are, and we have residents in places who don't have access because of income, and we have places where those intersect, and this is a really strategic way to get essential services to folks who very clearly need them. We're obviously going to be having more people who are losing access to dental insurance. This need is only going to be continuing to increase, and this is a economical and strategic way to get some of that critical care to folks. We know that when people don't get dental care on time, that in particular is something that causes increasing other health effects in the body that eventually become a lot more severe. And that's something that we obviously disproportionately see in low-income communities and communities of color. So this is also an equity issue. So really appreciate the county executive's recommendation and the committee's support on this.
Great. Councilmember Albanese, sorry.
Thank you. So I mentioned it's going to be a tough day. So let me just say a few things about this. Clearly, as Councilmember Mink mentioned, we know the dental work is important. I very much appreciate the efforts of the public health team and Health and Human Services, also our friends and colleagues at Action in Montgomery, and a number of other key stakeholders who have pushed us
to be very busy. I don't know. I don't think it'll be able to fill all of that. So please take that into consideration. East County, with our school-based program, we have heard it from the schools about the need, and so we're finally getting into that area, but the need is greater. The parents need help too, right? Mm-hmm. So it is just please consider the entire need there across the whole services. We're trying.
Thank you. I appreciate that. So I'll just make an overarching 30,000-foot comment that connects to a comment that I made when we discussed our school system's operating budget. If we don't move forward with an income tax increase as a body, then we are going to have to make some very drastic reductions to all of the conversations we've had over the last few days. Sadly, because HHS's budget reflects such a large percentage of the executive branch's recommendation, there's no way, it's a math problem, that we're going to be able to achieve the reduction to the county executive's recommended additions without having to make some very challenging decisions. This is a great illustration. All things being equal, needless to say, we would love to keep and in fact increase where we can. And so for those reasons, I very reluctantly move that this be added to the reconciliation list, but acknowledging the importance of its work, and I certainly won't be heartbroken if it's not supported by colleagues. But I also, we have to reflect reality here. We're going to have to make some tough decisions over the next few days, particularly next week. So that's why I reluctantly move this forward.
All right. We have a motion. Do we have a second?
Second.
Councilmember Lukey, second. I have some folks in the queue. So we have before us an amendment to add to the reconciliation list the dental practices for the East County. And just so we're all clear on procedure, so because this is coming to us at this time, we will, after colleagues speak and ask questions, take a hand vote. And if a majority of the council would like to add this to the reconciliation list, it will be added to the reconciliation list that we will consider next week, which is different than when we take up reductions that have been proposed by committees. Does that make sense to everybody?
Yeah, and I'll note this will not be for every line item, I promise, colleagues.
Right.
This is just for a handful that are new since our conversations within committee. But that's why we're spending more time on this than we will some other items that we'll be discussing this morning.
Right. And the idea is that this is not a committee recommendation, and to give everyone time to also, if we put it on reconciliation, to think about it with everything else. So with that, I'll turn to Councilmember Sayles.
Thank you, Madam President. And, I wish we could fund every line item on this budget, but I cannot speak highly enough of ADG and the invaluable role that they play in providing culturally competent care in our community, and the services that they provide, from community outreach to our underserved communities, particularly among AAPI populations. And I know that the county executive also deeply values their contributions. They were so helpful during the pandemic, and they have pivoted to adapt to every need in our community. But this was for a new one-time contract for this fiscal year. It doesn't impact ADG's ongoing ability to continue delivering the other services through other existing partnerships that they have, through ongoing community-supported programs, and the generous funding that they receive from other sources. So this proposed reduction does not signal a withdrawal of support. It does reflect the need to apply consistent standards to all new funding requests, especially in a year of increasingly unpredictable fiscal constraints.
I'll note quickly that we are talking about item number 5 at the bottom of 13. So we will be talking about ADG in like the next 3 to 4, but the DHHS notes your comments.
Yeah. This is not for the 200?
No, this is for the
number
300,000. The
Yes.
what is being proposed, the amendment on the floor is to have this reduction added to the reconciliation list, which would be a reduction of $300,000 for East County residents for dental services.
Yes.
So that's the line item we're looking at.
Yes.
Okay.
So this was regarding the dental services that they provide. I know that we have the mobile clinic. I know that the universities at Shady Grove is also standing up weekend hours. And if you can speak to the expansion of the USG dental clinic.
Yes, I will ask Dr. Boyce to come back up. We officially launched our partnership with USG about 2 months ago, and it has been going very well. We are meeting all of their requests to give them clients, maybe a little too good, but I will let Dr. Boyce expand.
So yes, that agreement was finalized at the beginning of the year. In February, we started collaborating together and sending patients over to them for services. Some of these patients have been able to receive same week services or the next day, which is wonderful. Again, this focuses on adult patients. So far, we've sent about 150 patients over there. They have told us their clinics are full. Our patients do not show up. They come. They are very grateful. The word is spreading. It is beneficial to the students. The students are also coming to our clinics to participate and learn, doing screening events, which is just fabulous. So we have more scheduled dates for that. We are looking hopefully to expand this later and looking at this as the standard or kind of like this pilot as how we can collaborate with more of our community partners. It's a big operation. Our staff are the ones doing the pre-authorizations, the reviewing, all of those things that come in with all of this, but it is working well.
Good. I remember going to Howard University's dental school when I was younger. So to have something that's close in the community is going to help a lot of our residents. So thank you for that.
Thank you. Councilmember Mink.
Thank you. I think that, equity and parity for East County residents is going to be a theme of some of these conversations. Could you speak to the access to dental care in East County versus other areas of the county, acknowledging that the needs are great everywhere, and this is a pilot that you're hoping to be able to expand as a strategy to also increase care in other places. We have taken action to expand care in other locations in recent budgets, and we still have the Colesville Clinic that's been closed. So if you could just kind of speak broadly to that, that would be helpful.
And yes, I forgot to state my name. My name is Dr. Tricia Boyce. I'm the dental director for the county.
And we appreciate you. Thank you.
Yes, so one of the challenges with East County, even as we were exploring this potential opportunity, was we were looking at trying to find even those doctors and dentists in the area that took Medicaid. That was a challenge. there is a significant void. And again, that was echoed by when we went to set up services for our school-based program. That was echoed by the school teachers or the community services liaisons. The other thing is the distance for them to travel to a county clinic or even a collaborative partner can be somewhat challenging. So East County has definitely been void. Even as we look at partners, there's going to have to be significant effort, or it's really looking at practices who border that area. So access is challenging. While University of Maryland Shady Groves is great, again, the bulk of people who are going there are from our Gaithersburg area because it's only 15 minutes away. So, taking off time from work, traveling, those are all really social determinants of health that have great impact in accessing care. So yes, you're correct. It's a huge challenge from that standpoint.
And can I just add one other point when we talk about the broader strategy? So one of the challenges we have in dental, we know that Medicaid dental coverage is relatively new. And unfortunately, the reimbursement is not great to the point where private practices in the community don't want to take it. Our oral health fee schedule through the county actually pays slightly more than what state reimburses through Medicaid. So this is not just a strategy of coverage, but this is also a fiscal strategy that we have been considering. If we can get into contract with community dental providers that will take our uninsured clients, that frees up more space for us as the county to take more Medicaid patients that we can bill and reimburse for. So we are actually able to expand our capacity to see more clients because we have community partners that will probably be able to see people faster, that would be willing to take on our uninsured clients. That frees up space within our county clinics to see more Medicaid clients that we can reimburse and get revenue for, which right now we don't get revenue for the uninsured clients that we are covering.
That's a great point. Thank you.
And I just wanted to make another point. In a recent meeting as far as dental and Medicaid, there are a lot of concerns as to what is going to even happen with that. There was a push recently because of the rates being so low, trying to get the rates increased. We were basically told that will not happen. Okay, so, and then there was also a push because there are some non-covered items for adults to try and get those in there. That will not happen. That was just basically we were told. You're now looking at providers who weren't even happy with the status of it. They're going to be less likely to take those patients. So I just want to kind of paint that picture as what that outlook is going to look like. I don't know how many people are still going to have Medicaid, right? Are they going to now be relying on county resources? That's the other question. So there's a lot of question marks there.
Thank you. I think those are really important points, especially as we head into this time when we know that Medicaid is under direct attack. We are expecting rollbacks imminently, and it is our responsibility to ensure that we have the infrastructure here, that we have thought ahead and we have some infrastructure. And obviously, that's what we're all trying to do in a variety of ways. We're trying to think ahead by making sure that we have funding for all the different things. We don't have enough funding for everything. But I think that you raised some really important points about how this really directly lines up with the needs that we already have and the needs that are going to be increasing. And if you could speak briefly about the health risks when somebody does not receive dental care. And I'll note that I actually, not too long ago, just before the change of administration, when we still had a meaningful Department of Education, at one of our clinics to help folks get rid of their student debt by finding out that they're eligible for that. We met somebody there who had really severe dental needs that had been ongoing for a long time, but had not, someone who had not been able to afford treatment and, to find and to get to someone who would be able to provide her with that care. And it was really, it was not something that we could just let sit, obviously. But it was a very, very difficult problem to solve. And we actually reached out to American Diversity Group because we know that Mayor Modi has so many connections in the community, but it's a lot of that kind of pulling strings and trying to find a friendly private provider who's willing to, and so this is a way of systematizing that that I think makes a lot of sense. But when we think about delaying this and about access and about long-term health consequences, why is dental care kind of the tip of the spear for that? Why is the dental care so critical when we look at impact on the rest of the body and delayed dental care?
I think people forget that teeth are connected to the rest of the body. I mean, really. And so infections, while they can start out being localized, again, they're connected to the rest of the body and they're entering the bloodstream, going elsewhere. People also remember that the oral cavity is kind of a window into everything else going on. We have a lot of clients who have uncontrolled diabetes. Their teeth are falling out because of this. It's connected to other diseases. You're seeing this because of other things going on. So neglecting your dental care, a lot of times we end up being that emergency clinic in the county. By the time they're coming to us, things have really gone awry, but then sometimes we're finding other things that are going on that are actually contributing to this issue. So, and then basically, if your teeth are hurting, are you eating correctly and nutrition-wise? So everything is connected. I know it comes across as something significant, but a lot of times, especially with our client base, there are bigger issues going on.
Thank you. Okay, I appreciate the conversation, and I do appreciate the tough decisions and the efforts that the chair is making to be responsible as we look at the budget. I certainly understand, the effort there. I would ask that colleagues not make this something that is on the chopping block. That's up for consideration. This is not about adding a new nice to have. This is really attempting to bring equity to East County, and access that they have been lacking, that we have been seeing on the ground, is desperately needed. And I would ask that this not be one of the pieces that we put up for consideration to fight against other new programs and new enhancements. Thank you.
Councilmember Sales.
Thank you. Just wanted to share the other line item of the $333,785 for specialty dental, behavioral health. Can you tell us more about that line item and how others can access those resources for dental services?
That's the Care for Kids item supporting the supplemental that was approved in January. Mm-hmm. So they can talk about them at length, but part of the services are similar to, I'll say, Montgomery Cares, and that children, they can access primary care, but also ancillary services, including other specialty care services like ophthalmology, things like that. Yeah. And then there's also a line for specialty dental care. That specialty dental care line within Care for Kids is supported through mostly contracts. So the children, as part of their primary care, are seen at county dental clinics. Mm-hmm. But if they need specialized care, the Care for Kids program through the Primary Care Coalition maintains contracts to provide specialized dental care. Sometimes when children need to be when they have to go under anesthesia, they'll use that line item. So that $333,785 totally supports the increased need within Care for Kids, specialty dental medications, primary care visits, and what so have you.
Thank you. And so while this item is being proposed for the reconciliation list, this other item, how are we going to raise awareness about these other dental resources if this other item doesn't make it through budget?
Well, I don't want to speak, but I would say that they don't work in correlation because the programs are different. So County Dental Services is really focused on the general residents of the county. The only children that they do see are Care for Kids children. So all of the referrals flow through Care for Kids to the County Dental Services Clinic.
Okay.
It's part of the comprehensive service package of being a Care for Kids client, and this takes into account the enrollment growth, which Council, thank you, gave us a supplemental for earlier in the year.
And I just wanted to add, in the last few years, coming out of COVID, we've seen an increase in the complexity of cases coming that require specialty. there's a lot of advanced medical conditions that these children are coming with in addition to oral health. PCC does have a contracted provider, but that provider will not see those children with those advanced medical conditions for their oral care. So that has been a challenge too. We're trying to work with the University of Maryland to see what we can do about sending patients there, but that the specialty item has increased for dental needs because of the level of complexity that we're starting to see more and more.
Well, I just want to be very clear that we're not using county specialty care dollars to then pay our county dental clinic. So the specialty care dental line is only to reimburse contracted providers. So in terms of the fiscal, they're very separate.
Okay.
So when children are referred to county dental services, that's all in kind. So.
Councilmember Alvarez?
Thank you. I'll be very brief. So just tremendous respect for Councilmember Mink, who often attends our HHS committee sessions because of her deep-rooted passion and interest in this subject area. This is a taste of the kinds of conversations we have within the committee. We've had multiple work sessions around the dental issue. We've made great progress as a system. Obviously, more progress needs to be made, and we will be having ongoing discussions within work sessions to continue to invest in this really, really, really key area. But as I said at the beginning, reluctantly move forward items that, for consideration and also for transparency, because understandably in previous years there's been frustration over reductions that were made, not in sessions such as this. And in light of the conversations we've had earlier this week, that's why we're proposing a few small but important changes to what has been recommended with the committee. This is one of them. I assure colleagues again, we will not be doing this for all items. But this was one that we wanted to uplift. So with that, I yield back to you, Madam President, but obviously there's a motion and second on the floor.
Great, thank you very much. Again, this is to put this reduction on the reconciliation list that we will consider next week. All those in favor of adding this to the reconciliation list as a reduction, please raise your hand. It is 9 to 2, sorry. 3. 8 to 3. Oh, can you raise your hands again, because make sure the clerk got it? Okay. 8 to 3, thank you. All right, let's move on to the next item.
The next item is number 6 on page 14 of your packet. This is related to the transition or the phase 2 part of the dental program conversion. The dental program uses contract staff, and they would like to transition them to merit. So this 140,227 would support the transition of 5 principal administrative aid positions. Okay, we will move on to item number 7. This reflects a new service line that is recommended within Care for Kids, which is reproductive health services. So the funding would support reproductive health and family planning for youth enrolled in Care for Kids. Of course, we know Care for Kids runs from 0 to 19, so a certain segment in age of that population. The council staff made a recommendation to tranche this item for potential reduction, as there are Title X clinics in the county that provide these reproductive health resources. There are at least 3 clinics, one that is part of our Montgomery Cares network. I won't call them out by name. So there are reproductive health resources in the community for this age group. So that was the reason for the recommendation, and the committee moved this recommendation forward. And these 2 tranches are currently listed on the reconciliation list.
Councilman Roberts?
Thank you. So, same prevailing issue. Obviously, this and so much of what we're discussing is important, but what we tried to do is, if there were other services being provided, even though obviously we'd love to expand as much as possible, that was where we made some tough decisions, but acknowledge completely the importance of this particular line item in light of everything that's happening in the world. But just wanted to provide some context regarding the committee's recommendation.
Great. Thank you, Councilmember Alvarez, on this. And I just would ask Dr. Ashford to speak to this. I know this is an area I know well and from a previous life. And unfortunately, our Title X clinics are seeing their funding cut dramatically, especially when it comes to reproductive health care. And we also know the barriers young people face, needing to go to multiple places to receive this type of care. And while I fully appreciate the exercise we're taking here, I just would like to ask Dr. Ashford to speak to this and the care that's needed in the community.
Yeah, absolutely. So when our Care for Kids clients, as Ms. Clemens Johnson shared, some of our Montgomery Cares clinics do provide these services as part of their FQHC Bless You structure, but it is not available at all of our clinics. And we know that if our young people have to leave one place to go to another just to pick up their birth control prescription, the likelihood that they're going to do that is slim to none. And we talk a lot about, equity and social justice, and I am a reproductive justice champion, which means you have the right to decide when to have children or when not to have children, and you have autonomy over your body to do that in a safe place. And so I view this really as a reproductive justice issue. If we are not giving these young people access to birth control to make those decisions for themselves, and we know, given their status, it is unlikely they will be able to access these services other places because they are on Care for Kids. We are increasing the risk for unintended pregnancy outcomes. They then get to be part of our teen pregnancy program in the schools, and we know that those babies probably won't be born into the best financial situations, and we then continue the cycle. So this, from our perspective, is a very much big need. It is a reproductive justice issue, and I know it is a tight budget season, but it is a small, from my perspective, investment to prevent potentially very lifelong and expensive downstream consequences.
Okay. Councilmember Balcom.
Thank you. Council President asked one of the questions that I was going to ask in terms of the availability of care elsewhere. Can you talk just briefly? In the packet, it talks about the Title X, Title 10 clinics. Where is that funding coming from?
That's federal funding.
Okay, so my concern about this is what happens if that funding goes away. That's critical for me. And I wasn't even thinking of the travel perspective. So, we all know teens and we all know that the behavior is whatever's easy for them. And if we put obstacles in their way, then that's difficult. So the tranches, perhaps the chair or Dr. Ashford could talk about the tranches in terms of if we tranched it, if we looked at half of the money, just the need. I'm sure you need more than you've asked for, but could we do one tranche, restore one tranche, and leave the other one on the rec list? What would that do, and could that be a possible solution?
So there's a couple, thank you for the question, Councilmember Balcom. There's a couple of options here. Either if we did one tranche versus the other, ideally we'll use, the data to see where we might target our services. So we could either say we're going to provide services at all of the clinics and every clinic will get a set amount, and when it's gone, and we'll have to wait till next fiscal year to resume those services. Now, I'm sure, and Dr. Davis in the back, from a clinical perspective, stopping your birth control for 4 months until the new fiscal year starts is likely not the best clinically sound decision. So what we would likely do is say, okay, where are we seeing the highest preponderance of young people, particularly female or birthing individuals, and targeting services there so that we can make sure that they have a continuity of care for the entire fiscal year if we tranched it out.
Mm-hmm. And then when you made the determination of the cost, the 180, how did you come about that?
Yeah, that was just by looking at the cost of the birth control that we can get at a reduced rate as a local health department, and then the number of Care for Kids clients within that childbearing age from when they start their menses
Sure.
through the time of the program.
Okay. So I'm torn, not about restoring it. I'm torn between whether we should restore the full amount or 90
$90,000. I don't know the will of the body. So I'm going to make a motion that we restore this full item.
Second.
Yeah.
All right. We have Council Vice President Jawando.
Thank you. I was going to make a similar motion. I'm glad you made it already, Councilmember Balcom. I agree it's a small amount for a super important preventative strategy. And if to the point that was made in the last conversation around dental, there was a memo out yesterday from the Congressional Budget Office outlining how states and localities will have to react to the deep Medicaid cuts. This is one of the items that's mentioned. It's one of the items that's targeted, reproductive costs and reimbursements and such. So I think we have to do this, and I know these, and I will support the motion. Thank you.
Councilmember Albanese.
Thanks. I appreciate the robust conversation. I think all of this makes perfect sense, and I will also support the motion. I just want to note that, and as was stated at the beginning by Ms. Clemens Johnson, we have done supplemental appropriations regularly, particularly in the Health and Human Service space, in reaction to changes that have been made in the federal government before, and we stand ready to do that again. So while we're discussing these items within the context right now of the FY26 operating budget, this is an example of where we may have to make additional investments based on what comes down the pike. So thank you.
Great. All right. So what is on the table now, since this was a committee recommendation to put this as a reduction, we have a motion and a second and a third, I think, to take this off the list as a reduction and to put it back into the base budget. So all those in favor, please raise your hand. And that is unanimous. And thank you, everyone. Thank you, Dr. Ashford. And I agree with Chair Albanese that, we know there's going to be more, but to have this amount, because going off your birth control is not a great thing. So appreciate the work there. I'll turn it back to Ms. Clemens Johnson.
We move to item number 8, which is a HHS committee recommended budget item not included in the county executive's recommendation. This is to support behavioral health co-pays for the Care for Kids clients in the amount of $6,750. It would support approximately 450 Care for Kids families, so they would have no out-of-pocket costs for their behavioral health visit, and the committee recommends approval 3-0. Okay, I'm going to combine the next two items, number 9 and number 10. The county executive recommended the reduction of 2 contracts, one for stroke prevention and one for health education. It was noted that the health initiatives, the Age African American Health Program and the Latino Health Initiative provide similar services. And so the executive recommended this reduction, noting that they felt that the Minority Health Initiative were already engaged in supporting this work. Okay, we will move on to item number 11 on page 15 of your packet. The HHS committee recommended budget item is supporting the it is a council executive recommended item, but the HHS committee did vote in approval. This is for the American Diversities Group Free Medical Clinic. There was a lot of conversation during the HHS committee about supporting this clinic individually in the scope of the primary care medical services that are provided through the host of services that DHHS provides, namely Montgomery Cares. So ADG provides clinical services in East County and they have been committed to this work for quite some time. But it was noted that this is like one-time seed money to support a physician, a nurse practitioner, and other support staff, not on a full-time basis. They will continue to try to leverage their volunteer physicians, and they would like to expand their clinical hours and increase the number of patients seen. The committee recommended 2-to-1, but wanted to note the following, that this would be one-time funding and would be a new contract. They also noted that there should be clearly defined criteria to ensure consistency and equity in the county's investment in community medical clinics that serve unique populations and address urgent needs. And then there was also a question about, with this being one-time seed money, what does this mean ongoing for the American Diversity Group? But the vote was 2-1.
Okay. Great. Councilmember Mink?
Thank you. Appreciate the committee's vote on this as well to move this forward. I want to clarify a couple things as I did at committee. First is that this line item is not for an expansion in services. This is for maintenance of services. I think that there was some confusion for two reasons. One was that their original request to the county executive was larger, and that would have included an expansion. And the other is that over the course of the year, just recently, for the first time since their opening, they had to decrease services because the funding field is so different, difficult out there. They've really been. They spend a lot of time, many of you know Mayor Modi, a lot of time is spent between clinic hours going after grants and private support. And, he has really been trying, the clinic have really been trying not to come to the county because they know that they want the HHS funding and the county funding to be able to go as far as they can and take a lot of pride in working really hard to try not to ask the county for that. But everybody is going after grants and private funding now to an increasing degree, and it's a very, very, very tough field out there. And so as a result of that, and as a result of, increased costs as they compete with, providers and who are really working at a very reduced rate, and they have to make difficult choices for their household about where to spend their time, as well as other staff who are working hours there, they just have not been able to keep people on board. And so for the first time, they have recently closed their Sunday hours. That is an important day because they're open on weekends. And that is why, a big part of why they're such an important part of the healthcare infrastructure in the county, because many of our county clinics do not have weekend hours. And so this is where a lot of folks go when there are those urgent needs on the weekend. They're also, one of their biggest referrers right now are the hospitals, because hospitals know that on the weekends they can turn to American Diversity Group. They take clients actually not just from East County, although they're obviously critical to East County, but because of their hours and also because of their language supports that they have there. They have 7 non-English languages that are represented at that clinic, including Hindi, Urdu, Pashto, Nepali, as well as Spanish, of course. They serve a lot of clients who really can't be served adequately elsewhere, as everybody knows. A language line is just not sufficient when we're talking about getting medical care and the need to interface with a real person. But they also serve from other areas mobility impaired residents who need transport, as well as clients who don't have access to weekend hours somewhere near them. So they go and they get rides and they pick people up and they bring people to their clinic from Damascus, Laytonsville, Dickerson, Poolesville, Barnesville, parts of Darnestown, as well as obviously across East County. And I also want to be very clear that they also are working to help connect residents to and enroll in insurance and healthcare programs, including Medicaid, getting them in touch with the minority health programs, getting folks who are enrolled in Montgomery Cares and Care for Kids. So they are a part of our, county healthcare ecosystem in a number of ways. They are a trusted partner, and they're also helping to move people into onto other programs that are county funded as well. So I just want to be really, really clear that, again, this is not about an expansion other than the fact that they are trying to come back up to be able to keep those Sunday hours open again, which they are not right now. And it's a reduction in what they had asked for originally from the county executive. And if we don't have this infrastructure, there are going to be people who are not able to receive care. And I'll note also that the referrals that they're getting from the hospitals, like the hospitals know them. Adventist has given them grants to help to sustain their work. So they are very much partners there too. They are, whereas Adventist has told me they send their frequent flyers there to try to get them to not be frequent flyers in the ER. So with that, I ask that we protect this budget line. Thank you.
Thank you. And just to make sure everyone's clear, this is a committee recommendation to add this to the reconciliation list. So it's not a cut, it's not a reduction, right?
To keep it in the budget.
Keep it in
It
the
would be
budget.
to keep it
Right.
in the budget. It was recommended by the executive.
Right. So it's not on any list to reduce.
Correct.
So we got a lot to go through. I just want to make sure people are understanding where we are. No one has suggested reducing this at the moment. It's to keep it in. Councilmember Balcom.
Thank you. I can't add any more to what Kristen said, Councilmember Mink said about the value. It's remarkable the value that we've received from ADG through the years without any contribution from the county, and so I support this. I do, however, want to talk about the process aspect of adding this. I appreciate that this is one-time funding, and I think it's really important to convey that to ADG because they are a trusted partner. However, there is the question about are they doing an end round to get into our budget? And I think that that's a really important aspect that we need to have a fuller conversation, in the convening time between this budget and next budget. So I think that that's really, I just wanted to lift that up, that because very often what happens with one-time items, they're going to come back next year and say we can't continue to do services without additional funding next year. So I'm sure that the chair will have that conversation in the intervening year. So I just wanted to highlight that. Thank you.
Thank you. Councilmember Alvarado.
Thanks. So we did have a robust conversation about the American Diversity Group. I've had a chance to visit them, and I'm familiar with their work as well. And I want to say three things about this. One, I'll pick up where Councilmember Balcom just left off. That was my concern too. There are other volunteer organizations doing great work in our community that, thank goodness, they're doing that work in our community. So we did discuss establishing more firmly moving forward a set of criteria for recommendations. The public health team does a phenomenal job of looking at the landscape and where the holes are. And so there was a strategic recommendation made by them because they identified a hole within the system. But I was concerned that there wasn't necessarily as competitive of a process as there are in other areas for them to be able to receive funding. I don't disagree with anything that Councilmember Mink said, and do understand and recognize their investments and their ability to reach more diverse populations than we can on our own. I was prepared to move this, but in light of the conversation that we had earlier that lasted a really long time, and the fact that we have to get through so much of this here in the budget, I'm going to hold off on moving this particular item to the reconciliation list, but acknowledge one last time that I don't know how we're going to make all of the numbers work at the end of this process. And because HHS's budget represents such a large portion of the budget as a whole, we're going to have to go through this. And so that's a headache we're going to have in about 72 hours. But it's a headache we're going to have collectively as a body. So, but I don't think it's worth moving the reduction at this point, given the amount of time that we've invested and how much more we have to go.
Thank you, Councilmember Albanaz. And so we'll move on to the next item.
Thank you. So I'll just briefly note, number 12 speaks to the community reinvestment and repair funds. The council was briefed on this earlier in the year when we added the commission. This is state funding, part of the general fund, but special funds, and can only be used for the purposes outlined by the state and the county. The Community Reimbursement Commission has not begun meeting yet, but will in the next month or two. I'll say the vast majority of this funding, only $100,000 of it is for administrative costs. The other $2.4 million will be used directly for grant programming in FY26, and will continue on as long as the cannabis laws at the state level do not change. And that is it for public health services.
Great, thank you. And I think the only item that's on the table that and Chair Albanaz and Ms. Clemens Johnson, correct me if I'm wrong here, that we should take a hand vote on is the reduction of the 81,827 when we talked about the new clinic at the Islamic Center of Maryland. Is that correct?
Correct.
All right. All those in favor of that reduction, please raise your hand. And that is 9-2. All right.
Maybe call for both votes, like for and against, because I've been getting confused.
Oh, okay. All right, sure. Sorry. All right. All those in favor of the reduction, please raise your hand. All right. Those opposed? Oh, sorry. For some reason, I'm not seeing your hand. It's you. All right. That is 8-3. I did. Yes. I think it's the orange or something. All right. It is 8-3. Thank you, Council Vice President Jawando. Appreciate that. All right. Thank you, Dr. Ashford, for this morning. We will now move, I think, on to Ms. Clemens John, Administration and Support Services. Chair Albanaz, is that
correct?
Good. All right. This is your show. I'm going to turn it over to you.
Do admin. Okay. For services, we're going to do admin. Okay.
Thank you, colleagues. So we moved up our public health team. We're now, I think, back on track. And so we will now be discussing the Department of Health and Human Services Administration and Support Services. I turn it back over to the team to walk us through the packet.
Thank you. So we are starting on page 5 of your packet with this admin and support section. There are a few changes, but most notably changes in consideration by the committee that will be discussed. The first item is House Bill grant changes, HB 669. This is a grant that dates back to 1996 that we received for support services. The increases and decreases every year. This year, the amount is $15.4 million. The HHS committee recommended approval for this item. And the next item is number 2, increase in security services at DHHS programs. This is going to support the increased cost of this security service contract at 4 different HHS buildings. All of the buildings are very public-facing, serving Medicaid clients and things like that. So this is just to reinforce that contract. And for the next, I'll just do mine. So there is as we saw with the public health services, there was a recommendation from the CE to reduce the Latino Health Initiative contract for media relations. They are going to bring this, they no longer need that money in the contract as they are not using it for that service. LHI uses a different model of marketing. I think they call it social engineering, something like that. So they just didn't see that there was a need to maintain this money in the contract. So the HHS committee voted in approval of the CE's recommendation. And I'll move to my colleague.
All right. The next 2 items, item 4 and item 5 on page 6, are related. The county executive is recommending the transition and shift of funding for the pop-up pantry services. That was $53,107, and for $753,775 for the school-based food assistant program, all to transition to the Office of Food Systems Resilience, which was, of course, reviewed earlier this morning, and the committee recommends approval of the county executive's recommendation for both.
All right, and the last item the last item for reduction is a correction that removed the ARPA funding. It was incorrectly included in the FY25 budget, so OMB just noted that they were taking that money out. So you'll see that error in some of the multi-program adjustments within the budget. So if you see this big, large item, it's related to this old ARPA funding item. And so the next item we move is in recommended restoration by the HHS committee of the MVMA non-competitive contract for FY26 in the amount of $89,941. So for FY25, this item does not show up in the county executive's recommended budget as a budget line item. It was just part of the base. And so what DHHS was in transition of doing is for FY26, this funding of $89,941 lives within that the African American Health Initiatives budget under the Office of Community Affairs. They wanted to transition it from their contract to the Healthy Community Funds. That was part of the recommendations that came over, but wasn't explicitly detailed in their packet because it was just a shift in how they chose to use their funding. It was a reduction to the contract, but not a reduction to their overall budget. So there was advocacy and a recommendation by Councilmember Mink to restore the contract for MVMA. So this placed $89,941 on the reconciliation budget item. It needed to be added if the contract needed to be restored, because the recommendation had already, the recommendation eliminates the contract. So the item on the reconciliation list would restore or start the contract for FY26. And the HHS committee recommended this 3-0. There's several memos and from Councilmember Mink and information in general, as this item came up last year for elimination, about the background of this contract. So I can address any technical questions about how to move forward or addressing any questions about the contract as well as the department.
Thank you. I'm going to turn over to Councilmember Mink, who will hopefully be able to navigate us through this.
Thanks. Yeah. So I was just talking with Sonia Moore yesterday about this, and really appreciate HHS helping to, I think, get this cleared up. The confusion, I think, came from the fact that that MVMA already has within the Healthy Communities Fund, which is a competitive grant fund, they are basically at the cap of what they can receive there due to another program, which is different from this program, provides different services, although they do work in tandem with each other. The existing one that they have in the Healthy Communities Fund provides a variety of social activities for seniors, Vietnamese speaking primarily, the very robust programming, and then this contract, the $89,000 one, provides casework that helps them to connect to various healthcare services, enroll in Social Security, et cetera, as well as provide some tutoring to some Vietnamese-speaking youth. And so they work well together, but they're separate. And they would have been MVMA would have been fine with having it with the funds shifting to the Healthy Communities Fund, and just competing for it there, except that there is a cap on how much one organization can receive within the Healthy Communities Fund. So it would have essentially meant that it would have made it impossible for them to win both contracts because they're at the cap. And so acknowledging that there really is not another organization who can serve this population in terms of the languages that are spoken and the cultural needs that are there. They do a tremendous amount of really critical work on a relatively small budget. I have been through their reports about who they're serving, and I've also been to many of their events that's there. Want to make sure that they're able to continue doing that. And so really appreciate, we have an email that we received, thank you, Mr. Hodge, yesterday, suggesting, when I spoke to Sonia yesterday, Dr. Moore yesterday, she asked that we just shift that $89,000 back out of the Healthy Communities Fund and designate it for MVMA. So procedurally, my understanding is that we would have to do that as two motions. One of them we've basically already done, right? We've designated the MVMA 89,000, but this should be just functioning as a cost neutral shift. We have not reduced the Healthy Communities Fund by the same amount. And again, that had gone up in the county executive's budget as a result of the shift with the intent that they could compete for it there. So what I would like to do is just confirm with colleagues that it's okay with them if we do it this way as requested by HHS, that we do add a reduction of $89,941 for the Healthy Communities Fund. This is all within the Asian American Health Initiatives budget, to be very clear. So it all is going to stay within there. And that we ensure that the $89,000 line, which is on there as an addition, just because this is our process, that we ensure that we fund that we don't treat that again as fighting it out the same as the other items on the reconciliation list, because I want to make sure that we don't overall reduce $89,000 from both places. Essentially, those two pieces should work in tandem together to be a cost neutral shift to fix and address the issue that has come up, which is that, again, the shift into the Healthy Communities Fund was intended to let them fight for the contract there as well. They cannot do that because they're at the cap. And so the request is to just shift that back out. So would like to put that up for a conversation and see if colleagues would be amenable to that.
Councilmember Alvarez?
Thank you. So a couple thoughts, and then I'm going to need to phone a friend on this one for sure. First of all, once again, thank you, Councilmember Mink. She provided information to the committee regarding MVMA's work that we were not aware of. And she also shed some light on some of the contractual issues and was able to clear up a few things. Having said that, this does still remain a contracting issue between the Department of Health and Human Services and NVMA. And I know that work has been done to address those issues. And so my understanding, and Mr. Howard, I'm going to need your help here because you had sent an email this morning or last night that I thought provided some important clarity. But my understanding is that what the committee recommended remains true, which is that we recommended that the recommendation of the executive for the funds in the fund to remain there. But what we did as a committee, per the suggestion of Councilmember Mink, is recommend that we, in addition to that, add funding for the contract for MVMA. But what the committee decided unanimously was that that be part of the reconciliation process for consideration, not that it be put in the base. So I would just like some clarity, and I totally understand an interest in placing it in the base, but that was not what the committee had voted for. The committee had voted for it to be considered among the other reconciliation items, acknowledging it's going to be difficult to get off the reconciliation list as a whole, but that was my understanding of where we landed. Mr. Howard or Ms. Clemens-Johnson,
Sure.
From an
Sure,
administrative perspective, if we can clear that up.
Of course, not a problem. Yes, the committee placed the 89,000 plus on the reconciliation list as an addition, so that action still stands before you. There's been no recommended change to that. What I believe Councilmember Mink is also requesting is a separate action to place that corresponding amount as a reduction to the Healthy Communities Fund. I'm going to get the name wrong of it. AHI. Healthy Communities Grant Fund. Add that, and then when there will be two separate actions if the council were to agree with that proposal. And then when you are doing your reconciliation process, again, those are two separate items, but you could kind of consider them like as you make your decisions in tandem. Like if you were going to do one, you would do them both. So it would be a net neutral transaction. But again, that would be the decision of the full council as you're going through the reconciliation process.
I get that. I just want to make sure that the funding for the fund remains in place, and that because that obviously is critical, so that we don't inadvertently take away from the fund. So just want to make sure that that action doesn't do that.
It would put it both up for consideration. So depending on what the vote of the body is that yes, that you could do one or the other or do both, so that you could vote to approve the reduction of the Healthy Communities Fund and approve the increase of the 89,941, and that would be a net neutral change. Or the HHS committee vote as it stands right now is to keep the 89,941 within the Healthy Communities Fund. I think the total funding right now is $1.5 million, so $1.5 million plus that, and then also adding the 89,941, which would restore or create a contract for NVMA in FY26. As of right now, there is not a FY26 NVMA contract in the recommended budget.
Mm-hmm. Got it. So I don't 100% understand, but it sounds to me like our committee recommendation still holds true. So I don't quite understand the difference between what Councilmember Mink is proposing and what the committee is recommending, because it sounds like they both get us to the same place.
Thank you. Yeah, it's a good question, and it is admittedly a little bit confusing. Yes, so the only, and I'm not making the motion yet because again, I would appreciate kind of like a collegial understanding about where we're going to go from here, as Mr. Howard noted. But basically, what I'm suggesting is to make that action, make that line item that the committee placed on the reconciliation list at my request, to make that cost neutral by also adding a reduction to the Asian American Health Initiative's Healthy Communities Fund. And when I spoke to Director Moore last night, and per the email from Mr. Hodge that we got, that was essentially her recommendation. She said that, I understand that you placed after we confirmed that they would not be able to pursue both contracts within the Healthy Communities Fund, as was the described intention of making that shift, that it would be impossible for them to compete and receive both of those contracts. So that shift would end one of those contracts. Then she noted that her understanding was that we had placed that $89,000 for MVMA onto the reconciliation, that we had done that, but that we had not pulled it out of the Healthy Communities Fund, which again, they had shifted that was artificially.
Councilman
inflated
Mickey, if I
to
could
that.
just ask.
Yeah.
I apologize, and I appreciate all the work you have done on this, but it is incredibly confusing. I'd really like to hear from the staff. Like, what do you all need? You hear the intent, I think. You've had many conversations. Can you tell us what you need for us to proceed?
I will attempt to, yes. So my name is Mark Hodge. I'm the Chief Operating Officer for HHS. So the county executive agrees that putting this money back or allowing this money to go for MVMA is okay with him. Because of the way the budget proposal is written, though, the money is currently in the grant funds, and so as it stands now, they would have to apply for that because there's no other funding for them. If we move, and then the committee put the committee put the funding on the reconciliation list as an addition. So the 89,000 stays in the grant funds. This is my understanding that in addition on the reconciliation list for $89,000, that would be specific to MVMA. So, but that leads to my question, and maybe Craig can help with this too. If the council agrees to that $89,000 addition, they're going to have to designate MVMA for that, because that's not something because right now there's no money, there's no contract for FY26. So for MVMA or anybody for that matter, because it's now in the grant funds. So if you are pulling out or adding $89,000 for a specific nonprofit, that in the budget language, this maybe you guys can correct me, you will have to designate them as a sole source for this particular money. Is that correct? Am I understanding that correctly?
That is correct for if the council decides to add the $89,000 and designate it to MVMA. Okay. It would have to come over as part of the Section G that the CAO submits to the council.
Yeah, I have a couple of people in line, but Councilmember Lukey, do you mind if Councilmember Balcom goes first with a clarifying question on this point? Is that okay?
Well,
go ahead.
Yeah,
go ahead.
I might be able to make it clear. So, because at committee, we had a very robust discussion about this, right? And I want to sort of walk us through this. Maybe this will clarify it for others who are in the queue too. Currently, for this existing fiscal year, MVMA does have a contract for $89,000 that is run through HHS. Separately, they were awarded a grant for $147,000-ish, through this separate fund that's the Healthy Communities Fund, which is part of the AAHI program. Okay. And within that fund that AAHI has and gives grant awards to, that one has a cap of a maximum award of $150,000. Is that right? Okay. And HHS did not seek to renew a contract for the separate $89,000 contract, right? Okay. Let me finish my questions. Let me work through this. I don't need help from anybody else. Thanks so much. Everybody needs to stop that. That's been a trend this week, and I'd really love it to stop, okay? Because I will call it out. Now, within that, if as proposed by the committee, the $89,000 and whether we choose to do a sole source contract for MVMA for the work as noted and in the supplemental memo and as discussed at committee, that this organization would be done as a sole source contract if, in fact, as a body, we determine that it should be removed from the reconciliation list and included in the budget, right? Okay. That action does not affect AAHI's grant fund budget. So we can just leave it at that and consider it that way without adversely impacting the AAHI Healthy Communities Fund budget. Is that right? Okay. And so my understanding, based on the emails we received and the conversation that Councilmember Mink had with Director Mora, was a separate action that would consider a net neutral, if you will, posture. But it is, in fact, entirely possible for us to consider this without adversely taking action against the Healthy Communities Fund for AAHI, correct? Okay, and AAHI, have they had the opportunity to weigh in on this at all as to whether the impact of reducing their Healthy Communities Fund budget by $89,000 would in fact impact them?
They haven't, but it is an $89,000 increase from the previous year. So
because the funds were moved over.
Correct.
Okay.
Correct.
All right. So they are $89,000 net higher as proposed in the FY26 budget. Okay. But then there was, I assume, in this decision making by the department, some decision to allow AAHI flexibility in how those grants would be awarded. Is that right? Okay. And the department and or the program has the authority to shift the $150,000 cap for that grant fund? Should you choose to do so?
Yes, that is a department decision.
Okay. So that is an executive branch function that the department could in fact choose to do as well, regardless of whatever we do. Okay. That's all. Thank you. I yield.
Councilmember Malcolm. Thank you. That did not clarify everything. So the question was, when the initial question was about reducing the fund balance by, or adding the 89,000. So reducing AAHI fund balance of the 89,000, they had that was an increase. Did I hear you correctly? So they got an increase of 89. So reducing their fund balance by 89 would leave them whole. So the proposal that Councilmember Mink suggested of reducing AHI by 89, adding 89 to the MVMA would make the rec list net neutral.
Correct.
Okay.
Yes.
That doesn't resolve the issue of the naming MVMA specifically as a contractor. That still remains regardless of what happens on the rec list. Okay. All right. Thank you. Can I ask you a clarifying question? That's only if we select the addition, though. Yes.
Right.
Correct.
If the council decides that this additional $89,000, regardless of how you decide to do the grant fund, that we would have to be told to give this to MVMA.
Right. Councilmember Glass?
I appreciate the discussion. I also appreciate that HHS has a process, and that just like with our grants office, there are processes. They might not always be perfect, but we work through them. We highlight and channel the concerns of the community and the nonprofit organizations and work with you all. I think it very well may become problematic if the council starts picking specific organizations, because we have very specifically chosen not to do that with the grants process. And I know none of it is perfect. We're working through it, and we are channeling the concerns, and I appreciate all of the channeling that my colleagues are doing. But you are the administrators, you are the content experts, and I defer to the process. If at another point in time we need to change the process, let's have a conversation about that. An HHS committee, a GEO committee, a full council committee. But right now we have a process, and I'd like to keep to that process.
Councilmember Albornoz.
Thank you. Appreciate the conversation. Just 2 points. There is precedence for the council providing sole source contracts, but they have been done, at least since I've been around, in collaboration in unique circumstances in partnership with the executive branch to address immediate needs that were not originally identified. Both of the situations that I'm thinking of happened during COVID. So while we have the ability to do this procedurally, I am uncomfortable providing a sole source contract for an organization that has been in active negotiations through contract negotiations within HHS, and HHS made the recommendation to try and resolve this by having them competitively bid for those contracts, acknowledging there's a cap of $150,000, and that was why I ended up supporting the recommendation to put it on the reconciliation list, because you provided a solution that actually they can't formally apply for, because the cap's at 150, so the 89 would be on top of that. They wouldn't be eligible to apply, or they'd have to decide whether to apply for the 150 or some other combination. So I still stand by the committee's recommendation, but the question on the table is, do we support providing the sole source contract for MVMA? And that, I guess, is the motion that Councilmember Mink is making, or not, or just a contract for MVMA.
Councilmember Mink.
So yeah, to be clear, the budget line to restore their contract is already committee approved and supported, and I appreciate you reiterating the support, and it's already on the reconciliation list, and it's already designated for MVMA. The part that we're missing is my intent was to neither increase nor decrease the budget of the Asian American Health Initiative with that. My proposal, which was reiterated by Director Murrah when I spoke to her last night, and again, I want to be clear that this is this was her suggestion. I don't know if she was aware that this was also what we had talked about, but this was her suggestion and ask, which is in the email that we received from Mr. Hodge yesterday, was also to neither increase nor decrease the Asian American Health Initiative. It was upon understanding and confirming that their plan to move the $89,000 into the competitive grant fund, where MVMA could then compete for it, that is impossible, because it would be an impossible outcome for them to win both contracts. Understanding that, she asked that and I'm going to go back to the email, shift $89,941 out of the Healthy Communities Fund. That's the part that's not on the reconciliation list. That would be functionally a reduction, because it was added in the county executive's budget there, and designate it for MVMA. So the MVMA line the adding part is already on the reconciliation list, but the reduction of the Healthy Communities Fund is not, which, hey, if we want to increase AHI's budget, like I'm certainly not going to be the one to complain about that, but I'm just trying to do what we're all doing here and be fair and square and find I don't want to add, I'm not attempting to add costs here. So my motion would be, if colleagues were amenable to, as I think Mr. Howard said, well, to treat these basically as a pair. So if you want to leave it in the Healthy Communities Fund, then you would not take the reduction for the Healthy Communities Fund if I was to move that and we were to vote on it, and it would end up on the reductions list. And then you would take we would ensure that $89,000 ends up in one of those places, acknowledging again that the request here that I got from Director Mora was to choose the one where MVMA gets the designated line, but so treat those two items, if we add the reduction, as a pair. So we either take the reduction or eliminate the addition of the 89,000 for MVMA designated, which is currently on the reconciliation list, and then also take the reduction of this same amount for the Healthy Communities Fund, which would make them whole, return them to where they were in the previous year, or to remove the addition that the committee recommended and that Director Mora suggested that we put on there, but don't take the reduction for the Healthy Communities Fund, because again, the ask here is I certainly don't want to end up reducing AAHI's budget overall either. It's important work. So,
So Councilmember Mink, are you making that motion right now?
Are folks comfortable treating that as
I'm
pairing
going
those
to
together?
say this. We're spending 10 more minutes on this item. We have a lot of HHS items and other budgets to get to, and I very much appreciate everyone's time. And so I respectfully ask, if you're going to make the motion, to please make the motion.
All right. In that case, I'm going to hold on the motion until we can have conversations offline, and I'm happy to offer it as a reduction at a future session, unless, yep, that's what I'll do.
All right.
Will there be a future opportunity for me to add a reduction to the list? There will, right? No?
I guess we have everyone here now, and we've had the conversation. So I would ask that if
all right, I'll make the motion to add the reduction.
Thank you. Do I have a second for that, to add a reduction of $89,941 to the Healthy Communities Fund? Do I have a second? I'm not seeing a second. So what stands now in the HHS Administration and Supporting Services is a committee recommendation of the addition of $89,941. That will be on the reconciliation list that we will take up next week. I have a few other colleagues in the queue, so we'll do that, and then we are going to conclude our morning session. Again, I cannot express enough my deep appreciation for everyone at HHS and our own staff time for their time today as we work through this budget, and other folks who were on our agenda this morning, but that we will ask you to return at 1 o'clock. I have Councilmember Katz and then Albornoz.
Thank you very much, Madam President. I think what we've really maintained is that we've been able to make a more confusing topic even more confusing. And let me just be clear where I am. I'm in favor of number 7, the way it's written, to restore the MVMA non-competitive contract for FY26 for $89,941 as is on page 6 of the packet. I don't know how you're going to do it. I don't care. I don't care for the mechanics of how we do it, but that's where I am. Thank you very much, Madam President.
Councilmember Albornoz.
Thank you. I appreciate the conversation. Ultimately, what we are recommending as a committee is that MVMA still be considered within the operating budget, which is what we're recommending.
Okay. Thank you. All right. I think we are concluded with this now. All right.
Yes, with the admin and supportive services section.
All right. Great. All right. We are going to break now. Thank you, and we will return this afternoon. Yes. 1 o'clock. We're done until 1 o'clock. So everyone can get lunch, take a breath, get some water, and we'll be back at 1. Yes.
To do it. Meanwhile, Virginia's done all this other major development for transportation, and now they're getting ready to build massive BRT at scale. I don't know what it's going to take to wake people up to what's happening here, but people need to wake up. I'm disappointed in this action, and I've certainly heard from many residents who feel similarly. While the council may have the votes to override the veto, it doesn't make it right. My job is to look out for the long-term health of this county, and I'm going to keep doing that. This is, at a time when we don't know what's going to happen this year with the budget, we don't know what the federal government's going to do. Anything that reduces our revenues is not the good thing to be doing. last week I wrote the council and withdrew my proposal for a 3.5 cent property tax increase. Instead, I recommended that we raise the income tax rate from 3.2 to 3.3%. I told people when I put in the property tax increase that we were doing it because it is the only way the county can raise revenue. And this is true across the state, any county that's at 3.2, and a lot of counties are at 3.2, have no ability to raise their income taxes. And the limitations in our county where this is without being able to raise income taxes, which is more progressive, we had to look at the property tax. I told people I'd likely change things if there were changes in the state legislature. One of the big things that changed was allowing the county to increase, all the counties to increase their tax cap to 3.3 from 3.2%. So we coupled the proposal to raise it to 3.3 with an increase in the working families income supplement, which will help decrease the impact on working families. And it depends how much income you make and how much